Alright, so random pharmacy things. You can take ibuprofen and Tylenol at the same time. There's no interaction there. I've had patients ask me, and even some of my technicians ask me if they interact or if they can take them together. Absolutely, you can take them both together and dose them every 6 hours. Taking Adderall with something acidic like fruit juices technically can decrease absorption. This has to do with protonation of its basic primary mean. Ionized drugs and chemicals have a decreased penetration across cell membranes, in this case the gut epithelium. So if you take Adderall with something like Tums, which makes the environment more basic, you can technically get an increase in absorption. Little side tangent, but this is glycopyrrolate. It's a quaternary ammonium compound sometimes used with peptic ulcers and then also for excessive drooling or sweating. It's a peripherally acting muscarinic antagonist. It stays in the periphery because of this little charged ion group. Ionized drugs have very poor CNS penetration. They don't really cross the blood-brain barrier. This is good for anticholinergic medications because they have been linked to cognitive impairment and dementia with long-term usage. An example of an anticholinergic with really good CNS penetration is the antihistamine Benadryl. We're seeing studies come out showing increased risk of dementia with long-term usage. But glycopyrrolate comes as an oral tablet, an oral and an injectable solution, an inhaler for COPD, and then these little cloths. Qbrexza or glycopyrronium is specifically indicated for hyperhidrosis, which is excessive sweating. Another random pharmacy thing is that all GLP drugs, Trulicity, Ozempic, Mounjaro, have a black box warning of cancer in rodents at clinically relevant doses. This is specifically for medullary thyroid carcinoma or thyroid C cells, aka the parafollicular cells. These cells excrete a little hormone called calcitonin. It regulates calcium metabolism. Calcitonin decreases the action of something called osteoclasts. These are little cells that break down your bone to increase calcium levels. These C cells have also been known to secrete several neuroendocrine peptides in much smaller quantities like serotonin, somatostatin, CGRP, and may play a role in regulating thyroid hormone synthesis locally. Another random little tangent is calcitonin nasal spray is a refrigerated synthetic calcitonin that we use sometimes in postmenopausal patients who have osteoporosis. It's reserved last line for patients who can't tolerate bisphosphonates like alendronate, raloxifene, Prolia, parathyroid hormone analogs. Benefits have only really been seen in reducing vertebral fractures, not really like hip or non-vertebral fractures. I've also seen calcitonin used to help with fracture healing. I'm not sure of its placement in therapy with this. Another interesting pharmacy thing is you can use the inhalers Symbicort and Dulera as emergency or rescue inhalers for asthma. This is due to the active ingredient called formoterol. Formoterol is a long-acting beta agonist, or a LABA. It has an onset of action of about 5 minutes, like albuterol, but it lasts longer than albuterol. Important to note, you cannot use Advair as an emergency inhaler. This might kill you. The active ingredient of salmeterol has an onset of action of about 20 minutes, so it's not fast enough. The GINA guidelines actually changed a few years ago to where that inhaled corticosteroid formoterol combo, that Symbicort or Dulera, is the preferred therapy for maintenance and reliever. This is called SMART therapy, or single maintenance and reliever therapy. The severity and frequency of your symptoms will determine the frequency and dose of your inhaler.